Hello, everyone. My name is Ryan. I'm the Director of Community Health Programs at ACT, formerly the AIDS Committee of Toronto. I want to acknowledge that this work was a collaborative effort of Mike Smith and Tyler Morden, who do a ton of work at ACT, and they're fabulous to work with, and a collaboration with Parkdale Queen West and Hassle Free Clinic. So what this project is, it's a pilot project where basically we brought point-of-care HIV testing into ACT in partnership with these other community health services. What made it a bit different from a Toronto context was the ways in which we started the process and the way we implemented it. So for us at ACT, it involved a literature review and a series of focus groups. We took it to community and said, what are your needs around HIV testing? What are your experiences and what are your barriers? And so we did a series of open focus groups specific to BIPOC guys and specific to trans individuals to say what are the unique needs of some of these groups. We also did one-on-one interviews with service providers as well as just individuals who weren't able to speak or didn't feel comfortable in a focus group setting. I'm going to go through some of these other things, but in addition to that, we developed partnership agreements. For the first 41 weeks of the pilot, we worked with Parkdale Queen West, which was a community health center doing peer-based testing. And then more recently, we've shifted over to working with Hassle Free Clinic. And as you can imagine, each of those partnership agreements have their own complexities and layers and stuff. So we'll do all of that. So this was our promotion of posters and coasters. And the posters were done on social media and those types of things. The coasters were distributed throughout the village to try and bring awareness to testing. With the promotion, and what we heard a lot in the focus groups and interviews was that wait times was the biggest criticism or concern about experiences of testing. So really wanted to find innovative ways or try and find ways to reduce wait times. So who was accessing services over this first 47 weeks? In the initial tests with Parkdale Queen West, there were over 424 individuals who came for tests, and that was over 4 individual Wednesday evenings at the ACT space. So in ACT, we had a dedicated waiting area for this where individuals could come in, they would be given a number, and some basic demographic information would be gathered, and throughout this process, an evaluation was involved, but I'll talk about that. Then we switched over to hassle-free, and on average, for the wait time was around 9 minutes, so wanting to kind of cut down as best as possible. That being said, there was an average of 10 tests per week. So the uptake is at that level, and we're going to need to continue to be innovative and think about the ways we manage this moving forward. One of the ways we've done that is to implement a texting service. So people are given a number and told where they are in the queue, but if someone comes in and this wait period looks long, or they've hooked up with 4 other people in the room that they don't want to sit next to for the next 20 minutes, they can leave us with the phone number and we'll text them and tell them, hey, go to a coffee shop or the LCBO downstairs and grab what you need, and you can come back, we'll text you when your testing spot is open. Who came for tests? So about 24 individuals was their first time testing, and so we saw a lot of that. Young people, 25 to 30, a lot of cis guys, and so part of our response to that has been dedicating one evening per month that has been about a targeted promotion for trans and non-binary individuals in partnership with the 519 to make sure we have peers and representation in the space to make sure we're reaching the right populations and making that space as accessible as we can. As far as the ethno-racial demographics, we saw a broad range. As we all know, Toronto is multicultural, and we wanted to make sure that this space felt comfortable for individuals. So that's what that looks like. And then we also evaluated how people were hearing about it. So all of that to be said, that's point-of-care testing. Most people are familiar with that. What I'm excited about with this particular project are two pieces. One is the counseling. Every single person was offered pre- and post-test counseling. In addition to that, no matter how your test came out, individuals were offered subsequent counseling on site, excuse me, where people could come to counseling for whatever they wanted. It was free, it was confidential, and immediately after their test, they could be taken to another counselor's office. And that included things that were whatever was coming out for that person. Themes that have been prominent have been childhood trauma and sexual violence, substance use, crystal meth, and others, anxiety about this test and frequency of testing, relationship stuff, and then also psychoeducational and links to how do you get PrEP, how do you get PEP, how often should I be testing based on the kinds of sex I'm having. And 95 of the individuals that came through for testing accessed this service, and that was one of the pieces of feedback that we got that people really appreciated. Beyond that, subsequent counseling is available. They've been connected to care, they've been connected to services that act, ongoing counseling is available to them. Evaluation. One of the things that I think is challenging for me as a person, as a gay man in Toronto, is sometimes I go through a process of getting tested and I don't ever feel like I have a mechanism to provide input into what that experience was like. And so, and this came through in the focus groups and the interviews around, I want to have a voice in an ongoing way in this process. And so, anonymous paper evaluations are available in the waiting area, as well as a Mentimeter is posted, or an online survey is posted in our waiting room. And we're asking for everything from how was the waiting area to how long was your wait? What was your testing experience? If you accessed counseling, what was that like for you? And we're able to do real-time responses. Because it's a small partnership between two organizations, we're able to, because they're queer men, and some of the things they commented most was the aesthetics of the waiting room, we're able to do real-time adaptations from week to week. The lighting should change. I'm looking for softer lighting. I want a bit more art, so those types of things. And so we're trying to make a comfortable space as best we can. But that also is the way we leverage and engage in partnerships and feedback. So when we're doing a partnership with an organization that maybe one of the ways we're able to provide feedback is at the end of each evening, the volunteer who runs the waiting room and the staff at ACT and the testers have a debrief session where they can say, how did tonight go? When we had a reactive test, how did we respond to that, and are we okay? Are we happy with the choices, the way we processed that? But also we're able to say, this is the feedback we got tonight. What can we do better next week? And so those are things about responses, the kinds of questions, and kind of providing real-time feedback to the testers, who are peer testers, about what we can do to make people feel more comfortable and improve that testing experience. So that's some of the stuff. We've gotten really positive feedback. And people have been really happy with the wait times. These are some quotes about the experiences, but what people have been most happy with so far has been the shorter wait times. And thanks to those people. Again, this is not just my work. Tyler had a poster yesterday, and Mike Smith's doing a presentation about some of this work later this afternoon. Okay, thanks.